All right, last question. Save the best for last, Dr. Baraki. We're gonna shit on doctors. Why do you think some MDs get sucked into promoting fad diets? Do you want to start on this, or you want me to?
I mean, I can hypothesize, I guess. I think the first thing is that doctors are humans. And so
Yeah.
humans get sucked into all sorts of things. There's not, anything that fully, protects them from natural kind of conspiratorial type thinking, which is very common in like the fad diet space, or, dollar signs making people do certain things. And so those are probably the first two things that come to mind that would attract people in that direction. But those are just my off the dome thoughts. What do you think?
Well, my thing is like, generally speaking, I think that the number of physicians that do in fact promote fad diets, whether it is for financial gain, whether it is due to conspiratorial thinking, I think that they're a statistical outlier. There's just not that. Look, if there's 100 of them, fine. But there's 12 million physicians worldwide. So all you're seeing here is the impact of social media and like these platforms that people have with very, large microphones, and they can, say whatever. That all being said, I would suspect that if nutrition education was better in medical school and more doctors got exposed to this, maybe that would be lessened. But because it's such a small number of physicians, and generally they just do seem to all follow the same damn pathway. It's like functional medicine, longevity type stuff, and then they start spewing nonsense about nutrition. I don't know that it would help. It's my feel-good story. I'm like, look, if we increase nutrition training, behavior change counseling training, made doctors learn how to cook and do this stuff, it would help society. And then you, on the other end, the Night King, you're like, nah.
Yeah, I'm less convinced that it would have a huge effect. I think it would maybe have some positive in some folks, but at the same time, those who maybe come into medical school already with a conspiratorial mindset, maybe they're just going to already come in, ready to reject this as well. This is the dietary guidelines from the government, dude, and I'm not listening to this or whatever.
I had the opposite experience. You go back 2010, 2011, Jordan Feigenbaum. You're like, hey, what's the best diet I can eat for health? And I'm like, it kind of probably looks like the paleo diet, but with like more carbs, less, not processed stuff, but mostly like paleo, whatever. And maybe you avoid gluten and whatever. And the saturated fat stuff's all bullshit. So like, don't worry about it.
Yeah, right.
And so it's not that was like miles away from what I think now is like the quote optimal diet. It's just too rigid. Right. I'm like, well, there's a lot of different ways you could do it. You could be vegan, you could be vegetarian, you could be like paleo-ish, it could be, whatever. And I wouldn't be as hard-lined on like eliminating gluten from the diet. I wouldn't be as hard-lined about, I would maybe be more hard-lined about saturated fat and eating all this red meat, probably not the best, eat more plant foods, stuff like that. But as soon as I was introduced to like scientific evidence and the hierarchy of scientific evidence and like had to consume it like pretty regularly, I was like, it was almost, it was like a rite of passage. You have to go through like, what am I reading? And then you have to, you wrestle with like, okay, well, is this legit or is my prior belief system legit or whatever? Mm-hmm. But I actually found it very freeing in a way. I'm like, I don't have to like make this up.
Yeah.
I can literally stand on the shoulders of giants in the research space, and I can say, look, there's multiple converging lines of evidence that have brought me to my current position right now, which, oh, by the way, isn't like my position that I own and like carved out myself. It's kind of like, this is what I think based on the evidence. And if the evidence changes, so do I.
Yeah.
And
not
it's nice.
Not tying your identity to stuff like that is really nice, which is, I think, something that we enjoy the luxury of, is not having a identitarian kind of perspective on any of these things as it relates to training or nutrition. I truly like don't actually care about a lot of these things in like a personal way. Just my preference is my preference. But to your point, there's a lot of ways that you can achieve success in a lot of these different areas.
Okay, a few lightning round questions and we'll wrap this up. One, do you think if we increase the nutrition education that doctors get in medical school, right now it's less than 5, then like 66%, 2/3 of medical students right now get less than 5 hours of nutrition education. Do you think if we bump that up, we'll call 20 hours of the best nutrition education? I give the lecture, assuming I'm the best. Do you think that actually improves patient outcomes in primary care related to nutrition counseling?
Probably not. And the reason why is because I think you can appreciate this more so than maybe many of our audience members who have not gone through medical training, is that what you learn in medical school, even though it's 4 years of learning a lot of stuff, it is a small amount of what ends up being applied in your day-to-day practice, right? So if I think back, for example, to like first year of medical school, how much of the material that I learned in first year of medical school is stuff that I routinely apply day to day when seeing real patients, making real decisions in practice in the hospital setting? Really very little, right? Most of what I do, think, decide, manage, treat is stuff that I learned and absorbed mostly in the context of residency, and then honestly from like on-the-job learning after residency. Medical school is it's necessary to lay the foundation so that you can learn what you need to learn in those subsequent steps. But I think it's just so early that if you meet a first-year med student or a second-year med student, and it's great if you want to introduce this stuff to them, but if it is not kind of maintained as a steady drip of exposure throughout the rest of their school, and certainly throughout residency training, then it's just not something like a third-year resident who is in the depths of their final rotations or seeing a full continuity clinic day or something like that. They're not thinking about what's that lecture that I had as a spring first-year medical student, and so I think it's necessary. It should, I'm not arguing this to say that type of education should not be increased in school, but rather that if we want to make any kind of impact on that, it needs to be more of a longitudinal, steady curriculum across medical training. And it's going to be introduced in medical school, but it needs to be more heavily emphasized in residency and in the specialties that are going to interface the most with things where that's relevant to be talking about, right? So if you're a neurosurgeon who specializes in like resecting glioblastomas, then maybe spending a ton of time learning nutrition education is not as valuable as spending more time in the operating room practicing cutting out these tumors. But if you're a primary care, if you're a pediatrician, if you're, I don't know, maybe even an orthopedist seeing patients who have like, very obesity related issues, arthritis, things like that, then those are all types of situations where having a bit of nutrition education and behavior change counseling under your belt would be useful. But you don't get that from a couple hours of more hours, or 20 hours, 30 hours, 50 hours in medical school is not going to be enough. It needs to be spread out and maintained throughout postgraduate education as well.
It's just my ploy to like remove maybe like immunology or something, or just because like, come on, man, let's wait till we get to pathophys and like we'll get the deets. All right, second question, the lightning round. Similar type of scenario, but it's exercise related training. So in this scenario, in medical school, there's protected time where medical students get to exercise or learn to exercise, and they get additional training on behavior change counseling related to exercise. So, hypothetically, they'd be more apt to like recommend them to patients if they're doing it or have done it, have experience with it, and are well trained with behavior change counseling. Would that improve patient outcomes in like primary care specialties?
I also would give I think a similar answer here, but I'd actually be almost more in favor of this, mainly because I think that to the extent that it could be deployed and actually get these students doing this stuff, I think it would be so much better for them as they go through their training.
Better doctors,
and I think they'd be, healthier, mental health would be better, stress management would be better. They'd probably actually learn more effectively. They'd probably sleep better. A lot of things would be better. And then maybe by way of them personally directly enjoying the benefits of this, then maybe that would actually increase the uptake of it more. I still think that if it's not, somehow, persistent throughout residency training, then it's something that's going to fade away by the time people are actually in practice. Yeah. I truly think that so little of what I was exposed to in school is stuff that I can see day to day that directly impacts things. That's not to say it wasn't necessary at the time as like a building block, as a foundation builder, but the biggest impacts on my practice were experiences in residency, working with mentors in that context, and then things that I've learned on the job since then, or done my own self-directed learning since then.
Yeah. All right. That's it. The end of the lightning round. You just crusher of joy in Dark Knight. All right. Fair enough. Well, that is a wrap here on the Barbell Medicine podcast. Thank you so much for tuning in. All of the links to the stuff we discussed in here are in the show notes below. But before you guys go anywhere, please leave us a 5-star rating and a review. It really helps drive traffic to our podcast so we can keep bringing you all the latest nuance in health and fitness. From everyone here at Barbell Medicine, I'm Dr. Jordan Feigenbaum. We'll catch you next week and every week right here on the Barbell Medicine podcast.